صباح الخير. The topic of my presentation today will be trismus. Trismus is defined as a reduced mobility of the mandible resulting from tonic contraction of the muscles of mastication. That's to say, trismus denotes limited mandibular movement. The effect of limited mouth opening will include many factors. Trismus, which limits the mandibular movement and restricts the opening of the mouth, might lead to compromised oral hygiene, more difficulty in chewing and or swallowing, limits the access for dental treatment, increased risk of aspiration, impaired speech, increased risk of osteoid necrosis or death of bone as we discussed before. زي ما انتوا عارفين، لو العيان مش قادر يحرك بقه، مش قادر يفتح قوي، مش هيعرف يعمل proper toothbrushing. ادي فاكتور. بالنسبة له الأكل مشكلة. بالنسبة له لو عنده dental pain, you will not be able to manage this patient. صعب قوي تعرف تاخد له impression. حالات الماكسيلكتومي or mandibular defects لما تجيلك بتريزمس هتلاقيك مش عارف حتى to check if the tray size is suitable or not. فكل ده factors. طب لو حاولت تشتغل له عندك possibility ان انت ممكن he can aspirate اي foreign body فايل اي حاجة. فالشغل مع عيان مش قادر يفتح بقه قوي عملية صعبة جدا. Unless the jaw is exercised, mouth opening can become more limited and aggravate the problem. Pain, inflammation, and digestive changes of the joint are secondary effects of trismus. However, early intervention is essential to minimize the effects of trismus, and a thorough evaluation is crucial to any treatment plan. بمعنى thorough evaluation of the cause of trismus is very important to diagnose how to treat this patient. Etiology of trismus. Trismus may be due to acute factors, chronic factors, or treatment-related factors. Acute, chronic, or treatment-related factors. Starting with acute factors, either due to local trauma, which can occur during an inferior alveolar nerve block, which can result in muscle inflammation that limits the movement and causes pain. Also, trauma due to accidents can be an acute cause for trismus, in addition to post-surgical effect, nerve damage, muscle damage, or scarring may be a possible cause of trismus. The second acute factor is drug toxicity. Neuroleptic agents and hallucine. Neuroleptic agents are drugs used for management of epilepsy. Hallucine is a gas used for general anesthesia. Drug toxicity of these agents, let's say overdose, can result in trismus. Third cause is infection. Infection of the pterygomandibular space or the lateral pharyngeal space can limit the mandibular movement, for example, which occurs with pericoronitis. Pericoronitis is inflammation of the soft tissue surrounding the third molar. This will result in limited mandibular movement as a result of inflammation. in addition to post surgical infection ممكن after any surgery in the mandible inflammation will spread to the pterygomandibular space and result in limited mandibular movement. Chronic factors. Many chronic factors may be responsible for limiting the movement of the temporomandibular joint. First, TMDs, or what we call temporomandibular joint dysfunction syndrome, is the most common chronic cause of trismus. Second, rheumatoid arthritis can also be a cause of temporomandibular joint pain and restricts the mandibular movement. As you all know, arthritis affects the joint and can also affect the temporomandibular joint. Pathological processes as osteoma of the mandible, condyle or zygoma, or cyst or overgrowth of the condyle or conoid process of the mandible, all these pathological situations can lead to trismus. Ankylosis. Ankylosis, sometimes inflammation, results in fibrosis followed by bony union between the parts of the joint, which we call it ankylosed joint. That's to say, the patient cannot move the joint. Ankylosis may be either intracapsular, which we call it true ankylosis, or extracapsular, outside the capsule, and we call it false ankylosis, of course. Intracapsular, the union between the parts of the joint will totally limit the mandibular motion. Scleroderma may be a cause of trismus. Systemic disease like meningitis, epilepsy, or brain tumors, or CNS disorders, all of these can result in trismus. Congenital and developmental disorders, that's to say, congenital abnormalities in the conoid process may, or in the condyle, may result in limited mandibular movements like conoid condyle hyperplasia or abnormal elongation of the conoid process. Treatment related factor, that's to say, trismus occurring after special treatment. First, as we discussed before, radiation therapy. Radiation therapy may limit the mandibular movement if the muscles of mastication or the temporomandibular joint is included in the treatment fields. It is most noticeable following nasopharyngeal, palatal tumors, as well as nasal sinus tumors. Why? Because radiation to these areas will be affecting the muscles of mastication or the temporomandibular joint, and thus will result in trismus. Okay. The second treatment related factor is chemotherapy. Chemotherapy also increases the severity of the condition of trismus. So, surgical resection of the maxilla and mandible will cause trismus. Why trismus? After surgical removal of a part of the maxilla or part of the mandible, fibrosis occurs, scarring of the tissues, and will limit the movement of the joint very much. Also, after orthognathic surgery, the limited movement may be due to muscular atrophy as a result of fixation. تعرفين بعد الأورثوغناثيك surgery بنعمل intermaxillary fixation، يعني بنثبت الأبر جوز واللور جوز مع بعض لغاية ما يحصل هيل. الفترة دي ممكن يحصل فيها ايه؟ muscular atrophy بعد ما تشيل intermaxillary fixation تلاقي الموفمنت of the mandible is very limited. Treatment of trismus. How to treat trismus? Trismus occurs with unknown frequency and severity. A maximum mandibular opening may be reduced to 10 to 15 millimeters only. تخيل بقى الاوبننج كلها لا تزيد عن سنتي ونص، يعني بالعافية يعرف يدخل معلقة صغيرة. ده طبعا هيبقى مشكلة كبيرة. To impair the mastication as well as preventing convenient oral access of a bolus of food. So, for treating trismus, the treatment modalities will include medical treatment, surgical treatment, or physical treatment. Each mode may be used alone or in combination with other modes of treatment. بمعنى أنا ممكن أستعمل medical treatment بس، ممكن أحتاج physical treatment بس، ممكن أحتاج medical treatment physical treatment، ممكن كل ده منفعش أضطر ألجأ للسيرجيكال treatment. يبقى أنا depending on the cause I will decide the modality of treatment to be used. Medical treatment. Antibiotics. When infection is the cause of trismus, antibiotics are the most important during the treatment of trismus. That's to say, it is the treatment of choice when the cause is infection. So, I am deciding the line of treatment depending on the cause. Anti-inflammatory. Arthritis, inflammation of the joint can be treated with anti-inflammatory agents, which will relieve the pain and result in some improvement in motion. Muscle relaxants may help in acute cases of limited mandibular movement. As I said, inflammation of the pterygomandibular space will result in inflammation around the muscles of mastication and limiting the movement of the mandible. Therefore, muscle relaxants will be very helpful in these situations. Surgical treatment. Surgery is the treatment of choice for removal of tumors, cysts, or foreign bodies. Surgery may also be indicated in temporomandibular joint ankylosing and scleroderma after more conservative therapy has failed. طبعا لو حصل bony ankylosing, that's to say intracapsular ankylosing in the joint, all other modes of treatment will not be successful. The only possible line of treatment will be surgery. Physical treatment. Objectives of physical treatment include stretching the connective tissue, stretching the muscles that have been weakened, mobilizing the joint, as well as reducing pain and inflammation. Several methods have been utilized to counteract trismus and increase the interarch space, including exercise, use of mechanical devices, as well as hot application which will aid in the improvement of circulation. بمعنى الفيزيكال تريتمنت عندنا حاجات بسيطة قوي اللي هي الاكسرسايز، دي اسهل حاجة. ما نفعتش هبتدي ألجأ لاستخدام ميكانيكال ديفايسز. مع دي او دي هستخدم هوت فومنتيشن. هوت فومنتيشن على الاريا اوف ذا temporomandibular joint بتحسن البلاد سيركوليشن وتساعدني ان الحالة تتحسن بسرعة. فدي adjunctive treatment للاكسرسايز او الميكانيكال ديفايس. Exercise. Exercise is indicated in case of radiation therapy following orthognathic surgery and for scleroderma patients. After radiation or orthognathic surgery, the early start of exercise will be very helpful in minimizing the effect of treatments. Techniques. Most simple technique is opening the mouth as wide as possible 20 times, 3 to 4 times per day. 3 to 4 times per day. Open as wide as possible, then close. Open as wide as possible for 20 successive times, and repeat this situation 3 or 4 times per day. Second is 8 to 10 actively assisted protrusive and lateral excursions. Actively assisted protrusive and lateral excursion should be done to exercise the pterygoid muscles. Actively assisted يعني هساعد الماندبل ان انا اعمل protrusion واعمل lateral excursion علشان اقدر to exercise the pterygoid muscles. طبعا مع دي ودي الهيت application هيبقى very helpful. For scleroderma patients, manually assisted exercise may also be used. بمعنى ممكن كمان احتاج الاوبننج وكلوزنج اوف ذا ماوس في حالات السكليروديرما، اضطر ان انا افتحه بايدي واقفله بايدي. طيب chewing gum تفتكروا مفيد ولا مش مفيد؟ Chewing gum has little or no therapeutic effect on trismus. Why? Because it exercises primarily the closing muscles instead of stretching the fibrotic tissue that holds the mandible closed. أنا عايز أساعد المسلز اللي بتعمل إيه؟ muscles which open the jaws. الchewing gum بيexercise الclosing muscles and not the opening muscles. And so it has little or no effect in case of trismus. اعتقاد خاطئ يقول لك ايه استخدم اللبان هتلاقي الفك بتاعك اتحسن، بالعكس ممكن تلاقي الموضوع ايه بقى اسوأ مش احسن. تريزماس ديفايس انا ممكن احتاج appliances، في منها simple appliances في advanced types. الابلاينسز دي هتبقى مساعدة قوي ان انا احسن التريزماس. يبقى Trismus appliance or Trismus device is an auxiliary prosthesis that assists the patient in increasing the oral aperture width to eat and maintain oral hygiene. Indication in all the previous situations, that is to say, adhesion and ankylosis, arthroplasty and arthroscopy, arthritis, disuse atrophy, facial muscle disorders, radiation therapy, reconstructive surgery, or joint replacement, temporomandibular joint dysfunction syndromes, or what we call TMDs, trauma and condyle fracture, trismus for any other reason, as well as stroke. In all these situations, the use of device will be very helpful. What are the types of mechanical devices? Mechanical devices can be used to increase the mouth opening on a slow incremental basis. That's to say, I will get very slow and gradual improvement in the mouth opening. And therefore, by time, the treatment will be very effective. Simple devices or traditional treatments, very simple, very available for all patients. How? The simple device allows the patient to control the timing and degree of pressure required to gradually increase jaw separation. However, there is only one problem, is that it only produces a unilateral force. That's to say, the effect will be concentrated only on one side. However, sometimes it may be able to apply the force on both sides at the same time, and therefore I will overcome the problem of applying a unilateral force. First one is manual pressure or mobilization, which can have some positive effect on mouth opening. However, passive motion has been demonstrated to be more effective. manual pressure يعني ايه؟ يعني انا هبتدي هول الماندبل كويس وابتدي افتحه بالعافيه واقفله افتحه بالعافيه 10 20 مره امرنه. ولكن لو البيشنت حاول يفتحه باسفلي من غير ما يساعده بتبقى الايفكت بتاعها ايه؟ احسن. وودن كلوسبل، وودن كلوسبل كنا عارفينه اللي هو المشبك بتاع الغسيل. لو تخيلت انت كده لو حطيته بين البوستيريور تيس، لما بتدوس من جنب الناحية التانية بتبتدي تبقى separated apart، وبالتالي it can be inserted between the arches while the patient applies gradual pressure. يقدر يعمل بيه فورس تحسن التريتمنت. تالت حاجة tapered threaded acrylic screw. Tapered threaded acrylic screw. It's a very simple device which is very effective. Sometimes we call it corkscrew. بيتعمل ازاي؟ هتجيب حتة واكس هتعملها شبه الكاروت، وبعدين بحرف الكارفر تعمل عليها، تبتدي من النارو اند لغاية الوايد اند، تعمل سبايرال like the screw nail exactly. بعد كده تتعمل طبعا في الواكس، بعد كده تعملها ايه فلاسكين واكس انيميشن وتحولها لاكريليك ريزن. الميزة فيها ان عشان هي زي السكرو هتقدر تدخلها جرادولي، يعني هدخل لفة واحدة 2 3 وهكذا لغاية ما اوصل للوايد ستيل، وبالتالي انا هقدر احصل على ايه gradual improvement in the muscle. The patient does this several times a day to apply a force to exercise a patient's muscle. يعني انا هعملها 4 مرات 10 مرات، هتلفه على قد ما تقدر، دخل بقى لفتين 3 4، تسيبه ربع ساعة 15 minutes، بعدين تاخد then take a rest for about 2 hours and repeat the situation again. Tongue depressors. It is a very simple method by placing tongue plates between the patient's posterior teeth and keep it for 5 to 10 minutes or even more every hour. When the mouth opening increases, you can add more tongue plates. Also, can be lubricated with petroleum jelly or glycerine and placed between the arches for 10 minutes to increase the opening. The most important thing is additional depressors can be added one at a time to increase the opening. بمعنى العيان عرف يدخلها خير وبركة، ما عرفش ممكن تعمل لها lubrication ببتروليوم جيلي اللي هو الفازلين او بجليسرين. ايه الميزة في التانج ديبريسورز؟ الميزة ان انا هبتدي بتلاتة، بعد كده بين اللي محطوطين هبتدي ادخل زي ما انا عايز. المفروض اوصل على الاقل ل 12 تانج ديبريسورز عشان احصل على acceptable mouth opening، اقدر اخد impression. اوكي طيب فرضنا العيان edentulous، في حل بسيط، تقدر تعمل اكريليك ستاند مغطي الابر ريدج واللور ريدج، وتستخدم سواء التانج ديبريسورز او الاكريليك سكرو. ده هينفع وده هينفع، بس لو استخدمت اكريليك سكرو لازم تعمل ايدج في الستاند علشان لما تلف السكرو ما يحصلوش any form of slippage. خدت بالك من الصورة اللي تحت هتلاقي الستاند فيه ايدج كده، الايدج دي علشان يمسك فيها ايه السبايرال بتاع السكرو. A very important notice is that applying bilateral technique to overcome the force that are exerted unilaterally by using corkscrew or wooden tongue depressors without and with stent. يعني صحيح unilateral force مش مفيدة، ولكن انا اقدر لو حطيت يمين وشمال نفس العدد من التانج ديبريسورز او استخدمت 2 اكريليك سكروز، ده هيساعد ان انا يديني bilateral force application. Dynamic bite opener or trisma stance or temporomandibular joint exercise. These produce bilateral force and the prognosis for this type of prosthesis is enhanced when teeth are present. بنسميهم trisma stance or temporomandibular joint exercise. Those are group of devices used to improve the temporomandibular joint movement and exercise the movement of the joint. طبعا في old devices and recent devices. Old devices. Most famous one is the dynamic opening device. Consists of a stainless steel framework attached to maxillary and mandibular stents. These frameworks contain wires extending outside the patient mouth with special bends. يعني هو هيجي stainless steel framework as in the first photo. stainless steel framework دي will be fixed to a stand. الأبر واللور فيهم وايرز curving outside the oral cavity. الكيرفز بتاع الأبر غير بتاع اللور وفيهم special bends. You will apply elastics between these bends. It will provide a force opening the jaws. The second dynamic bite opener is the inflatable bite opener. Inflatable bite opener consists of maxillary and mandibular stents, an inflatable pediatric blood pressure, which is consisting of a bag, a rubber bulb, and a tube. يعني ايه كده؟ هنجيب جهاز الضغط بتاع الأطفال. ليه؟ لأنه الباج بتاعته صغير. هنعمل upper lower stent، هتدخل الباج بين الاتنين ستنتس. بعد كده انت عندك تيوب ورابر بالب بتقفل اللوكينج سكرو بتاع البالب، تبتدي تو بامب gradually. هتلاقي ان الباج started to inflate and separating the jaws. Leave it for 15 minutes and then release the air and it will go outside the mouth. Take a rest and repeat the procedure again 3 to 4 times per day or even more if you can. Or an intraoral prosthesis with interarch spring. It can be used for edentulous and dentures patient. يعني عندك upper denture و lower denture، لو عملت spring ما بينهم fixed للupper denture و lower denture هيديك positive force تفتح الجوز. طب العين dentulous مش edentulous، اقدر اعمل upper stent و lower stent. هتلاقي في spring very strong spring fixed to the upper stent as well as to the lower stent. This will apply a force separating the jaws apart. Recent devices. New exercise devices were introduced to help mandibular mobility, to improve restriction in the temporomandibular joint. These devices are available in different forms. المجموعة الأبلاينس دول جايين في كذا شكل على حسب الحالة. Most simple one is the spring. The spring acts similar to the effect of wooden closure. When you press on it, it separates the end. An important notice is that whatever the springs or the tongue depressors or the acrylic screws, these devices should not be applied to the anterior teeth. Why? Anterior teeth have single conical root, therefore I can get trauma to these teeth and I will get them loose very easily. I should only apply this force to the posterior teeth. The second is devices working by pumping action, as you see in the lower photo. This device has two extensions. You place it between the posterior teeth and you start pumping. The two parts will be separated from each other. The most famous mechanical stretching device is the TheraBite. TheraBite is a very effective mechanical device for reducing trismus and increasing the range of motion. ايه الميزة بتاعته؟ الميزة بتاعته ان انت هو بيجي معاه different ends على حسب السايز اللي عندك ما بين السنان. الميزة فيه ان هو جريدز 1 2 3 4 5، فتقدر تبقى عارف حصل improvement ولا لا. انت لما بتضغط عليه بيفصل الاندز بتاعته عن بعض. تقعد كده برضو 15 minutes، بعدين you release the screw in the back of the device, it will close again. فاما اعرف انا وصلت ليفل 4 ليفل 5 ليفل 6 هعرف الامبروفمنت بتاعي قد ايه. The last one is the computer controlled continuous passive motion device. Computer controlled continuous passive motion device or CPM. It is the most recent one in the management of trismus. برضو هو معاه small control unit ومعاه two ends you place the ends between the oral cavity, it will apply a continuous passive motion. بمعنى هتدي force for some time, then it can be programmed to increase the force after, say, if you have 5 minutes or something, then increase the force again after 10 minutes and so on. Therefore, we call it computer controlled continuous passive motion device. That's to say, it provides continuous motion at a gradual rate by programming the device. Thank you so much.